Hi, I am Dr.Moumita, General Physician. Do you know what is the most common cause in India which is causing more admission and death today? Guess what it is? What we won't even think. We'll think cancer, we'll think some infection, but the most common cause is hypertension. Yes, high BP. Okay, so you guessed it correctly. And see, BP is a very common thing, very ignorable thing, and it is there in almost each and every families. Okay, why we can't get the BP control earlier? Why we are not diagnosing the BP earlier? And why it is causing stroke? Why is it causing heart attack? Why is it causing death? Okay, let us see. We'll go one by one. So what is BP? BP is the pressure of blood which is coming towards the blood vessels. Okay, so that we will check manually or digitally. Okay, and we will see the high blood pressure. Why the blood pressure comes? There are multiple reasons. The most common reason is because of the age or the gene factor or some kind primary hypertension that is comes because of our lifestyle. We are so much stressed. We don't have sleep. We are not taking enough food. We are not taking healthy food. We are taking more of a processed food, more of a high sodium or high salt content food. Okay, and there are something called secondary hypertension, like people get BP in pregnancy, like people have BP who has kidney problem, like people has BP who has hormonal problem. Those are secondary causes. So we are not talking about the secondary hypertension today because those are very rare causes. We are talking about the commonest one, what we see day to day in each and every family members. Okay, so what are the symptoms? How do you know that you have BP? When you have to come to a doctor for the blood pressure? The main thing, if you can guess it right, I know many people will say incorrect because there is no symptom that will take you to or bring you to the hospital. 90% the blood pressure will be or high BP will be asymptomatic, means there won't be any symptom. So how you know that we are having BP? Maximum time when we check the patient normally and we see whenever you go to any doctor or we go for any health camp, we see the BP will be high. And first our thought will be, oh, I did not sleep last night. Oh, I just came by walking, or oh, I just had a cup of coffee. That's increased my BP. So ignorance. Sometimes ignorance is blissful, not this time. Okay. So why we are neglecting the BP? Because we don't have symptom. We think that BP machine is not correct properly. Okay. So don't become so much ignorant to the blood pressure. That doesn't mean that one time you have BP means you are already having hypertension patient and you have to take medicine. So we have to check it. So the most common symptom of BP or hypertension is asymptomatic. But some symptoms like blurred vision, your eyes you will be unable to see, severe headache, vomiting. Sometimes you will see that bleeding coming from the nose. Sometimes you will see palpitation, chest pain. Okay, so these are the symptoms you should never ignore, and these are red flag, and you should has to go to rush to the hospital or rush to the nearby doctor. Check your BP definitely, because that could be the initial or starting of a doom. Okay, so now you have, suppose somebody is having BP and they don't have symptoms, they are not checking their BP. What could be wrong? What will happen if your BP is 100, 200, whatever the number is? We'll think that BP is like a number. Oh doctor, I have checked my BP in the morning, it is 140. In the evening, it is 160. If I sleep, it will become 140. I did not sleep. So this is ignorance, because you are not going to check. And BP does not cause only because of you're not having sleep. Maybe it is already there. So that's the reason when we have to check it regularly, periodically. Okay. And again, it is vice versa. Another thing is also possible. Like you came to a clinic, you're already worried, anxious that maybe my BP is high. That time it can come falsely high also. That is called white coat hypertension. That is the reason if somebody is having high BP on first day, if your BP is not so high, we won't ask you to take for a BP tablet. We will say, go home, Check for 2 weeks, morning and evening, make it a list. You will only see that how much is the BP, and then we will plan for the medication or the lifestyle modification. Okay. So one thing that all the red flag sign, please don't ignore it. Okay. Now third thing, like next thing is, now what I told you is we'll have to go to home and check the BP. Can anybody check BP? Yes, anyone can check BP. That's very easy thing, and you don't have to spend much of money for checking the BP. It's not like a blood test. It's not like it's going to give you pain. So the most common cause of death can be preventable, like can be prevented without any blood test. So you can check your BP every day, not a problem. Okay. How we are going to check BP? So all of us, we know nowadays, because of digitalized, so it becomes so easy, so that everybody, even children, they can also check the blood pressure. Just put on and off. Only thing, few things that we need to monitor is that you are not in rushed, you have not have some heavy meal or tea or coffee prior you have taken the blood pressure, you have not have for any walking or any exercise session before it, any argument before it. Okay, don't check when you have fight with somebody and come and I think my BP is high, and don't check like that. Rest, take for 15-20 minutes and then check the BP. Okay, whenever we are checking the BP, we will see that our hand, wherever you are checking the BP, should be in your heart level. Okay, and the cuff size is important. If the cuff size is very small, it can give you, or is very small or very large, it can give you abnormal blood pressure also. Okay, so cuff size is important. Where we are keeping the binding the cuff is important. So it should be at least 2 to 3 fingers above to the elbow, above to the junction of the elbow. Another thing is, whenever you are checking the BP, see that you are sitting in a comfortable situation where your hand is supported by some table, not hanging, and your back should be supported. It should not be slouching, it should not be lying. Another thing is, your foot or leg should be parallel, it should not be crossed. Okay, these are the few things you see. Now you will ask me which hand to check, right hand, left hand. You can check any of the hands. Usually both the hands will be different, some 5 to 10 of BP checking, like mmHg will be different, but not more than that. If it is more than 10 or 20, you have to go to a doctor. Otherwise, any hand you can check. Now you know how to check the BP. Check it morning and evening. You will know how much is your BP and how you can control it. Okay. Now we will come for the few things. So suppose now, doctor, I got my BP 130/90. Should I start taking medicine? My BP is 100/70. Is it very low? Should I take some medicine? So what is the cutoff? Normally 120 to 140 systolic and 80 to 90 diastolic. Systolic is whenever we check the BP, the upper line. When you check it in the digital, you won't get it. When you will check it in the manually, when we heard the heart sound, the correct cough sound, that's called. So when the sound will start coming, that is called systolic. When it disappears, it's called diastolic. So both the things are important for a BP, to check the BP. So 120 to 140 is normal, 80 to 90 is normal for all the people. But if somebody is having diabetes, if somebody is having kidney problem or some other heart problem, for them we keep the cutoff little little earlier. So we keep the cutoff for them is 120 to 135 or 120 to 130, okay, or we'll keep from 85. So 130 to 85 we will keep. So we'll keep it, try to control it below 130 or below 85 for them. Otherwise normal people 140, 90 should be fine. Okay, but beyond 90 we will have to think about at least medical management or at least lifestyle modification.